So, Dr. Bharadwaj, I'd like to ask you firstly about the session you attended. How beneficial was it?
It was interesting. It was, I think, more informative for doctors who have come here for the first time, understanding more about the CTE angiography and the medical benefits of the diagnostic procedure that's going to be done. So probably for most of them, it was the first time, and it was interesting and as well as informative for them.
So, and what do you feel about the technology 128 slice CT scan?
Uh, we are kind of accepting what has been given to us, or whatever we are fed with. But I think the thinner the better. That's what they call it. And the more we can see, and the better it is for the patient in terms of diagnosing it early or understanding the disease much more smartly, and to take care of the medical and the treatment part in a more organized and in the early phase of the medical illness.
So, and with a reduced radiation dose, how beneficial do you think it is to the patients?
I think it is more beneficial in terms of the load of the radiation which we give, especially to the pediatric age groups, where we are diagnosing this, using this for ENT purposes, or for finding the malformations in the great vessels, or in the congenital heart diseases, where the dosage, because there'll be these small children which they get for come for CT angiography or CT scans. They're not the first timers, and that would not be the final investigation for him or her. There'll be many more investigations which will be happening in future. So the lesser the dosage of the radiation which we give to the child at that time would be better for him or her in the future. For the elderly, I think if it is the one investigation which he or she gets at 55, 56 or 60 age for diagnosing whether he has CAD or he doesn't have CAD, so there the dosage of the radiation is not compulsively kind of standardized, where we should give this much or that much. We are now aiming at understanding the illness by knowing what is there. So dosage obviously is a concern which would be the secondary to the investigation of the patient. That's about it.
And anything you would like to add on or tell us about non-invasive coronary CT angiographies?
I think interesting part in the community is the patient preparation for the coronary angiography, where the physician who refers the patient to a scan center should understand that the heart rate of the patient has to be reduced, and if there are any antihypertensives which can be given to him as for preparation, he has to be well fed, and of course an information brochure about the procedure has to be given in hand to the patient before he or she goes in for investigation. The informed consent is a part of the investigating center, but the information disseminated to the patient for the diagnosis and for the procedure has to be given by the physician. So these brochures about the CT angiography, etc., have to be with the physician, and probably not with the MRI or the scan center, because they are in a hurry to do the tests, and they have very less time to explain the procedure. And the explaining of a procedure can take up to half an hour for a physician, whereas the center is more ready to just wheel in a patient inside, give the dye, and start the procedure. So I think the patient information, probably if it is also on the net, the PDFs can be given to the patient. If he or she books an angiogram, can be emailed to him, or the relatives or the son and daughter can read it to them. And then they have to be then asked before the procedure that, did you read the information given to you when you were supposed to come here, and are you aware of what's going to happen? So not only the consent which you're focusing on, but also on the information which the patient is aware of. What is he or she, is he knowing what is happening to him, or what is going to be done for him? So that's essential. So I think information dissemination is a key to this test, because it's not an easy thing to lie down and get yourself injected, and then we are now comparing it whether this is vis-a-vis echo or a TMT, this is better. I would rather run half an hour on a TMT than go for a CT angiography. If I'm at 48, thinking I'm probably a smoker or something like that, and I feel I have a chest pain. So I would not, being a doctor, go for a CT angiography. I would rather do a TMT and an echo first. So it's vis-a-vis the information now. Whereas if I'm informed that this test is very sensitive, it's even better. And this can rule out your problems in a different way. So I feel that would be more appropriate. So the information given to the patient before the investigation is done is essentially a bigger part of the whole show than the show itself. So that's what I need to say. So the informed consent and the information disseminated to the patient is essential before he comes with the investigation. Any more questions?
Thank you, sir. Thank you so much. Thanks.